Lean Medical Billing website, and this is a continuation to our previous video, which is a claim lack information. Before going to that detailed information about the denial series, I just want to give information to the newcomers. We find a lot of subscription and a lot of views in our YouTube channel as well as for our website. See, those who are new, I just want to introduce ourselves. I'm Rajesh. I have around 17 years of experience in medical billing, and my major passion, I want to develop the knowledgeable team. And we are doing a two-way of training here. Okay, we will go through the general denial as a first week, and the second week we are going in depth. Okay, how we can improve our denial management process. Okay, that's what we are doing quite for 3 or 4 weeks. We are doing the same work. So I'll go through the same denial management slide, and then I will go through the lean way. See, last week we already covered, okay, what is a denial codes, which is related to our claim lack information. So I just give a quick recap. So as we discussed last week, we have around 12 codes, 12 denial codes, which will not make any clear decision what is our denial is. And we have 24 denials, which we can understand what type of denial it is. See, if you go to the EOB, okay, the EOB will have your denial code as COB15, and you will have other remark codes like RARC codes. In this 24, you will get a clear-cut instruction. For example, claim denied for lack information, and you know what is the denial is. It's add-on code. So you have to bill with additional, that is a primary code in this category. And if you go to the billing provider, address is missing, document is not sufficient. That's a major one. Okay, whatever the document you submitted is not sufficient, or if you didn't submit the document, you are going to send the document again. Okay. If you come back here, it's related to provider, NPI number missing or mismatched, and then patient waiting period and the penalty. It's some information you can get directly from here. But coming to this first 12, okay, so your information will not be clear why the claim is getting denied. So in that scenario, what you need to do, you have to go to your RARC code and you have to identify. This is what we discussed, right? In the RARC code, we have around 200 and we have more number. 830 RARC codes are there. Okay, if you go to the RARC code, many questions they ask where I can find the RARC code. If you go to any of the EOB, you will find two codes. One is a denial code, which your payment poster used to post, and in the same below that code, okay, if you go to that EOB and then see the denial code description, you will find denial code as well as the RARC code. This RARC code will give you the detailed information why these claims are getting denied. Okay, and if you go to the SOP, that's what we discussed last week. I'll quickly go through this SOPs. Okay, this is what our standard operating procedure when the claim is denied for a claim lack information. Okay, first what we'll do, we will check the EOB. If EOB is not there, we will check in the not available. We will check in the website to get the claim status. See, when we check in this too, okay, we will find what is a missing information, and we can go to the RARC code and then we can identify what is the required information by the payer. Okay, if you see that if by checking your RARC code and denial code, and if your what is the requirement, what is the missing information is clear, you can go ahead and then add that information and send it back to the payer. And if it is not clear, so you have to make a call to the payer and to understand what they need, right? And whatever they need, you can add that information in your claim form. You can send it as a corrected claim, or you can send back to the insurance by the call itself. See, most of the time we will have the missing information either from the patient or from the provider. Okay, the patient, it will be related to COB, PEC, that's pre-existing condition, AOB information, and then accident information. So when I posted this last week, we had some query saying that I told you that you are not going to get any pre-existing denial so far from 2012 because of your Affordable Care Act. I got some query that still some people are getting a denial for pre-existing condition. So please check whether it is related to pre-existing condition or related to diagnosis. Okay, if it is related to pre-existing condition, you can send your claim back for reprocess, because the claim cannot be denied for a pre-existing if your policy, the patient policy is taken yeah, on and after 2012. Okay, coming to provider, the claim can be denied for medical record or coding related. For example, DX is the pointer missing or DX is missing, and then modifier, CPT, and signature missing in the form, and then NPI number is missing. These kind of denials you will get it in the provider. And so when you decided to call, that's what we had discussed last week. So you can ask what is your denial date, what type of information you need, and then is it patient or from the provider. Okay, can we take it through the call? Then you can give it and then close this denial there itself. Okay, if they need a medical record, you have to ask what type of medical record they need. And if any information required from the provider, as usual, you know how to handle this patient related. Check with them whether they send a letter, and if it is greater than 30 days, ask them to send one more letter, and you get a call reference number. And if you desire to appeal, and get the fax number, and then where you are going to appeal it. That's our general workflow. Right. So now we are going to the lean way. Okay. So lean. I think we are discussing in the second time. See, whenever the lean is coming into a picture, what we are discussing here is we have to add some value in our process. Okay, that's what we are expecting. So in this denial, if your claim is coming as an input and we are doing some process that's worked by the AR, and you are going to give an output. See, here the input is the denied for missing information. That's a claim, and you are adding the missing information and you're going to get the payment. Okay, so it's definitely a value adding process. But in the lean way, okay, how we can fix it? See, as we discussed, in any lean process, we will first file or identify our value stream mapping or Gemba walk. See, first we'll go to the process. First, we'll do a claim filing. Claim will get denied, and we are going to check the EOB, and we are checking the RA/RC code. We are going to add required detail, and then refile the corrected claim, and we are going to get the payment. That's what the process which is existing here. So, in the lean way, how we can handle this? See, by going through this history of your claim lack information, by this time you know what all the claim lack information you are getting. So you can add that details into your billing audit. Okay, once a claim is ready to file, do a billing audit and then identify what all the things are required to be available. See, for example, based on your historic denial, identify what are all the details you have to add, and then you file your claim. Okay, file the claim with, see, for example, your history says the claim is getting denied for medical record always, right? In that scenario, what we are going to do here is, when we are filing a claim, so there is a shortcut way how to handle this medical record denial. When you're going to file a claim, what do you need to do in the claim? Okay, you have to add a reference number. It's based on your historical claim denial data for a medical record. So give a reference number there, and many of the practice management system have this option. Okay, before you file a claim, add a reference number in a claim form or your electronic claim, and you can file the claim. Okay, once a claim is accepted in your clearinghouse, okay, what do you need to do? With this reference number, you can fax your medical record. Okay, send the medical record with this particular reference number. You can either fax it or mail it, or even you can upload in their website. So by doing this, you can get a payment without the denial for anything else. Because see, when you take our regular process, the claim has to deny. Okay, and then you are going to check the EOB and you are going to add the required detail. See here, what will happen if you file the claim? To get a denial, you have to wait for at least 20 to 25 days, and after the 25 days you have to allot to your team and you are going to send the EOB. So if you take around 1 or 2 weeks to complete this process maximum, and it will again take their own processing time, so it will become again here 25 days we are wasting time, and here again around 25 to 30 days based on the pair processing method. So obviously you are losing your time for at least 45 to 50 days here. So to avoid that scenario, when you are adding the reference number and you're going to fax your medical record, by the time claim is getting processed, they know there is a reference number, and before the claim is getting processed, you are going to fax it, or you are going to upload your medical record, so your claim will get processed without the denial. So this is the way we are asking you to handle in the lean way. So what is happening here is, We know what is happening here, and in the billing audit we'll try to add all the missing information by doing a billing audit. Okay, after the billing audit, for example, NPI number missing, or any information related to provider, we can do a double check here and then fix it. For example, your historical denial report says the claim is denied for a medical record for a certain codes, say especially your surgery code or L code. So these are all the codes will deny for a medical record usually. So that records, you can add a reference number and then you can file your claim. So by this, what's happening is you are reducing your processing time and you can speed up your collections. Hope everyone enjoyed this video. You can go to our website www.leanmedicalbilling.com to get more additional information. Even you can download your denial codes, SOP, this particular Excel you can download from there. Thanks for watching us. Have a nice day. Bye.